The entire contents of this podcast and website are based upon the opinions of Tammy Garcia and her guests, unless otherwise noted. The information on this podcast is not intended to replace a one-on-one relationship with a qualified healthcare professional and is not intended as medical advice. It is intended as a sharing of knowledge and information from the research and experience of Tammy Garcia and her guests. This is the Naturally Inspired Podcast, coming to you from our 1890 homestead in Johnstown, Colorado. I'm Tammy, and I want to thank you for joining us. Let's get started and help people feel good so they can do what they love for longer. Today on the Naturally Inspired Podcast, Alyssa Megeath joins us. Alyssa is a certified birth doula and an Ayurvedic prenatal and postpartum specialist. Alyssa works with women through pregnancy and the birthing process. She is passionate about making sure families have the ideal birthing experience. Postpartum, she provides a very unique service where she creates meals with an Ayurvedic approach for optimum nutritional support for both mom and the family. I really enjoyed talking to Alyssa, and I hope you will too on this episode of the Naturally Inspired Podcast, number 37. Thank you, Alyssa, for being on the Naturally Inspired Podcast today. It's rough out there right now. And so I'm really grateful that you are willing to talk to me about what we're going to talk about today, which is, alternative medicine and different points of view. And just, the climate that we're living in, it takes courage to be able to put yourself out there. And I just want to recognize that. And thank you so much for being here to just have a good conversation with me today, face to face.
I wish more of my friends and family members would want to have this conversation because most of them don't really understand what I do.
Oh, wow. Really?
Yeah. And I do have medical doctors in my family. My mom always wanted me to become a medical doctor. I kind of let her down, I don't know, by not doing that. So it's nice when people want to know and they're like, tell us everything because this is stuff that we've never heard before.
Yeah. And hopefully they'll give this podcast a listen and your own, tribe, so to speak, will learn more about you.
Yeah. Yeah, totally.
I'll be like, I didn't know that.
Yeah.
How funny. How funny. So let's get started then and give our listeners a little bit of background about you. Okay. So where were you born?
So I was born in Medford, Massachusetts, which is a few minutes outside of Boston.
Oh, okay.
Yeah.
Nice. And did you grow up, did you have a big family, lots of siblings?
Yeah. So I actually have 3 siblings. I grew up in a family-owned business of 60 years. They sold the business.
Oh, wow.
I don't know, like 10 years ago. I grew up in the restaurant industry,
cool.
sitting there every single day, watching my parents. My parents actually separated because they were there with each other so much, and now they're back together.
Oh, interesting.
So strange, but yeah, that goes to show you, when you're with somebody 12 or more hours a day at work, and then you come home to them,
right?
It can be very
taxing
on a relationship.
Yeah.
And I have 2 sisters and a brother, and I'm in the middle.
Cool environment to grow up in, being in restaurant. I worked in restaurants, waited tables and stuff like that in my late teens, early 20s. And it's like a revolving door of culture when you're in a restaurant. Don't you think?
Yeah. So their restaurant was right across the street from Tufts University in Somerville, Medford, Mass area. A lot of well-known people have gone there. Very big science medicine hub,
right?
With the East Coast. All of those major teaching hospitals. The diversity that you see there, you will not see in Colorado, and I miss it. different walks of life, different financial status. The whole gamut. And really being able to sit at a stool as a young person and see that. And
just take it in.
Yeah. And
very cool.
I don't know, the work ethic that some people don't want to go to their job. And coronavirus.
A lot of people don't want to go to their job nowadays.
The positive with that is that the coronavirus is helping people shift careers.
That's true.
Decide this is what they really want to do, find their passion. Hey, I don't want to go to that job anymore. I haven't had to go there for 3 months.
And now I realized how much I hate it. Yeah. I'm happy when I'm not there, right?
Yeah.
I think so.
Yeah, so there's quite a bit of blessings that I think are happening right now, positively.
That's a good perspective. I like that. I hadn't really thought about it in that way.
Yeah.
So you're probably right.
Right now, though, like, imagine being a restaurant owner. I've talked to my father about it, and he's like, man, thank God we're not still doing this. Some of
the regulations are just unreal.
Yeah.
I don't know how they're functioning. Again, we're approaching this as with a symptomatic approach, right? We're treating symptoms. This is what we're going to do when we get it. But nobody's allowed to talk about what we can do to give ourselves the best fighting chance.
Totally. I'm a big Joe Rogan fan, and he talks about it a lot. And I don't have a TV in my house because I choose not to.
Yeah.
We're climbers in our house. We're trail runners. We have a garden. We want to be outside.
Yeah.
I'd rather not sit and watch the news that is making money to have viewers.
Yes.
I'd rather read, and I'll read lots of different things,
mm-hmm.
things that are opposing an opinion.
Yep.
And then kind of formulate my own, thing, and then tie in the experience to it.
Yeah.
So,
yeah. That's great. I couldn't have said it better myself. That's exactly how I roll here. We're not plugged into the news or TV. And we've never had cable since my kids were born. We never had cable, and we function just fine. We don't. I actually, when we're in public spaces and TV's on, it's kind of odd to watch it because you can see so clearly the motives behind what the programming is, and it's literally programming. And when you aren't exposed to it all the time, you're away from it, and then you come with fresh eyes and you look at it, it seems a little ridiculous.
Well, with the protests that happened, coronavirus disappeared.
Right.
I would tune in a little bit. I would go on my phone and see.
Oh, sure.
And the whole narrative of everything just stopped.
Yep.
And then it came back of all these protesters now have it.
Yep.
I've had a lot of friends and past clients that have gone to these protests that are fine.
Mm-hmm.
Some of them wore masks. Some of them didn't.
Yep. Yep.
So I don't know. It's better to just shut the TV off and go outside during that and not think about it.
Yeah. I hear you. I really hear you. How did you get kind of on this path of natural health, Alyssa? It's like you mentioned your family was in restaurant. Was this introduced to you in a way, kind of food as medicine, or how did that work?
No, that's a very good question. So, my family is Greek. My dad's family is Greek. My mom is French and Native American. So very different culture there. But Greek cuisine is very different compared to what we're having, here at a lot of our different restaurants.
Mm-hmm.
There is incorporation of spices like clove, allspice, garlic, fennel, coriander, and so is Indian cuisine.
Mm-hmm.
But we more so just ate based on taste and what we wanted to have.
Mm-hmm.
Prior to moving here, I moved here 6 years ago. I was living in Boston. I worked in hospitals all throughout the East Coast, and I worked for an electronic medical record company and then a breast cancer diagnostic company, and helping hospitals make higher reimbursement percentages based on women doing this modality and comparing it to mammograms. And doing that,
So it's diagnostic?
Diagnostic. So molecular breast imaging. And I was in the marketing side of things and doing grassroots campaigns for breast cancer diagnostic patients. And I don't have a master's degree or a PhD or whatever, but I would be meeting with oncologists and educating them and giving them research to read on mammography and molecular breast imaging, having lunch with them, having dinners with them. So it was pretty awesome. I'm young, so I was early 20s sitting in a radiology office with a 75-year-old radiologist. And he said, I want you to come back and we're going to go over some imaging. I'm going to show you the power of molecular breast imaging, what it has done for our patients here. And I was shocked. He was showing me on the screen of like, here, we detected this much sooner than a mammogram. Okay. This diagnostic system is a lot cheaper than a mammogram, but hospitals will make less money if they incorporate it in.
Oh.
My family, many of them have had breast cancer.
Okay.
Or, hey, we've had a mammogram. This doesn't look good. Come back in. My grandmother, I think, has had it 4 times and has had one of her breasts removed. Wow. So, yeah, I just started going down a rabbit hole of,
I guess. Okay, like, why is this not being approved? If this is better for the patient, what's going on?
Yeah. So I had so she has her master's degree in all research. So she would be giving me the studies. I would read the studies. I would be very familiar with them. And then there was a PhD team there that would look at sample size and everything. And so I was learning a lot from them in the circle.
Yeah.
I came out here mainly to climb and have access to being outside every day.
Right.
But when I came here,
that's what Colorado does. It draws people in for nature.
Yeah.
Yeah.
I started working in a traditional Chinese medicine clinic.
As soon as you got here in Colorado?
Yeah.
Okay. And that was based just kind of like on your experience working in the hospital system and kind of like a red flag there, like, hey, maybe I want to go with a more natural approach, learn more.
Yeah. And when I was telling my mom about this, she's like, oh man, you're in the earthy, crunchy land right now. And like, you moved here. So now you don't even want to entertain going back to school. My plan was to go to medical school. And then I was like, this is not what I want to be in. When I finally saw and learned the ins and outs of insurance reimbursement that pretty much has their foot on a hospital.
Yep.
Dictates everything.
Yep.
And that to me was a wake-up call.
Yeah.
I don't want to do this.
Yeah.
There are modalities out there that are way cheaper than, for example, I had somebody give birth 2 days ago, and she was telling me my multiple sclerosis medicine, of course her insurance covers it, but she has to take 2 rounds a year and it's $100,000 per time.
So her medication is $200,000 a year?
A year. And we were talking about this when she was in labor, because we had a nurse come in and ask, what do you want to do for newborn care preferences and blah, blah, blah. And the mom said, oh, I really love this book that you showed me. I read Dr. Sear's book on vaccines because I only had what Google was telling me. I only had what my provider was telling me. And I really want to know.
Right.
And
And this is the your person that you work with, because you're a doula as
yeah,
well.
yeah,
Yeah.
yeah. She's my birth client. She just gave birth. But these stories that I hear from these expecting families, I work with a high population that gets diagnosed with gestational diabetes, or that have type
Okay.
1 or type 2. None of them have been really discussed as far as diet goes
Right.
with their primary care doctor, endocrinologist, or midwife or doctor.
And they have diabetes.
Yes, and I had one client recently, and I was like, you should be teaching the provider on what your experiences are, because you pretty much have logged every single thing that you're doing for the past 35 years. You know this better than any textbook. And she
Right.
says, yeah, imagine how it is to explain this when someone's telling you you're doing something wrong, but you keep track of your levels and you're checking yourself every day. It's like banging your head against the wall.
Yeah.
And
Now, is she on medication, or is she controlling this with diet?
she has a pump.
She has a
The
pump.
person has
Okay.
a pump. Um, but yeah, we have a lot of food. So Ayurveda, a big portion of it is cooking for disease and to prevent disease.
Right.
Whether you have autoimmune, pre-diabetes, or diabetic, high blood pressure, low blood pressure, the whole gamut, we really tailor it to the person.
Right. So that's your specialty, and your set of skills is Ayurvedic functional medicine and a doula. So
Yeah, yeah,
you
yeah.
support moms who are giving birth through pregnancy and through the birth product process.
Hmm.
And this is so fascinating to me. You actually cook for them and care for them with healing foods through
Yeah,
this process.
yeah, yeah. So I was doing birth work prior to this. So since I
Okay.
moved here, and Chinese medicine exploded
Yeah.
my
So
mind
let's
and
get
just
into that a little bit. So you were working in the allopathic Western medicine model in the hospitals, kind of had a red flag there, right? You started seeing how decisions were made. So when you moved out here to Colorado, you decided to kind of shift gears, and you started working for a Chinese medicine practitioner. What were you doing there?
Pretty much everything. So from everything from doing all their insurance to
Okay.
running the office to talking to patients all day long to
Oh, awesome.
creating presentations for the acupuncturists to go and give in the neurosurgery community on the benefits of pre and post-operative Chinese
Acupuncture.
medicine and
Okay.
acupuncture. Um,
That's
oh my
awesome. It's like
gosh, it
that's like
was.
a paid internship, right?
Well, it was what I was doing for the breast cancer diagnostic company, strengthening those relationships,
Right.
really getting to know the patients and their stories. And wow, I am so impressed by Chinese medicine, and
Yeah.
why that, China, given the hub of where this has all started, and they're still trying to downplay Chinese medicine, Chinese
Yeah.
herbs, acupuncture, because it doesn't make money.
Right.
There will never be large clinical trials on any plant
Yeah.
because it won't make money. It's
Yeah.
not going to make millions of dollars. You can grow it in your backyard
Yeah.
if you live in the
They
ideal
can't
climate.
patent it.
Yeah. I had personally, so birth control causes a lot of dysregulation in the human body.
I cannot tell you how many times this topic has come up on this podcast.
Yeah.
If my faithful listeners are still on birth control or not thinking about birth control before they do it, I don't know what to say about that. I mean, I totally fully support a woman's right to choose whatever they want to do, but I fully support the 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 fact that we need to be educated on this issue way more than we are, because we are told that birth control is no big deal
Yeah.
and there's no side effects and it's awesome.
Mhm.
And every practitioner I have on this podcast, in some way or another, ends up talking about the side effects of birth control.
Yeah.
So I just had to say that. And I didn't mean to interrupt you because I'm very
No,
anxious to hear what you
no,
have to say. But it's just fascinating to me that we can put things in our bodies and think that there's no repercussions for it.
totally, totally. So since the age of 14, I've been on a handful of different oral contraceptives.
Mm-hmm.
I don't think that any of them have made me feel good.
Right.
Uh, so then for a while when I moved here, I was tracking my ovulation, didn't want to get pregnant, met my husband. We really wanted to um, have a family. And I bled for a month straight, transitioning off of a birth control.
Mm-hmm.
My skin felt like I was white and complex. I have like
Mm.
dark skin, dark
Yeah.
skin.
Mm-hmm.
I felt depleted.
Uh-huh.
I felt tired all the time.
Yeah.
I felt like I needed to drink coffee all during the day.
Yeah.
The head acupuncturist, her name is Erin Pass. She has a clinic in Boulder. Finally was like, why haven't you told me this? Like, I should be addressing this. So then she put me on a formula to help um, move the blood and get everything restored and balanced. I
Yeah.
was receiving acupuncture from her.
Mm-hmm.
My period got back on track, and within weeks later, we got pregnant.
Wow.
Yeah,
That's an
yeah.
amazing
Uh,
story.
she treats a lot of people, and there's other women that work with her for fertility purposes. And
Uh-huh.
compiling research with them, we've put together all these different studies from fertility to back pain to post-surgery. So those who are receiving in vitro fertilization to try to get pregnant,
Mm-hmm.
um, there is a higher efficacy of procedure working if mom is receiving acupuncture, I believe, right before and then after. Uh,
Interesting. And we're seeing so much more of that, right? I mean, I don't know.
yeah.
When I was a kid, my mom was a young mom, and so there was a lot of young women around us. She was like the first one to have kids, so we were always the only kids around. And I remember it was, I was probably already like 8 or 10 by the time her friends started having kids. I
Mm-hmm.
don't remember there ever really being a problem with infertility. And I know that's anecdotal, but that was just my perception at that age. Nobody really had a problem getting pregnant. And now
Mm-hmm.
I see it's a challenge to get pregnant. And
Yeah.
and we're recognizing that culturally, like, oh, this is, they had to go to in vitro, like it's a normal thing.
Yeah, totally, totally. I'm just going to silence my phone. I
Oh,
have a birth
sure.
person calling me. Uh, yeah, so it's such a multifaceted issue. I think our water sources, plastics,
Yeah, plastics, xenoestrogens. Yeah.
that's a big, um, and then also looking at both patients, a man and a woman. Um, for instance, we have many different couple scenarios now, woman and woman, man and man, but
Yep.
reproductive man and a woman, women are usually just being treated now to help their fertility versus a man also being examined.
That's
So
interesting. Yeah. Good
that's
point.
another uh, big piece of it. Um, diet. Diet is the cheapest way that we can impact our overall health. And
Yep.
I think a lot of people just jump the gun and say, oh, well, I can't go to chiropractic work because it's expensive, or I can't go to naturopathic medicine because it's expensive, or Ayurvedic medicine. But if you look at what you're paying for your insurance for a month and you are healthy and you're
Yeah.
not using it,
Yes.
a lot of these modalities, especially Ayurveda and Chinese medicine, you can practice on yourself every day.
Yep.
You can treat your whole family. It's been beautiful to incorporate these practices into our family life, and I'm still learning. I,
Yeah.
have classmates that have been studying this for almost 20 years. I've
Yeah.
only been studying it for a few years, and I have a long
Right.
way to go.
Yeah.
Um, but it is pretty life changing.
Yeah.
What? a few things can do to improve our overall well-being.
Yeah. Well, Ayurvedic medicine is over 5,000 years old.
Uh-huh.
And I started, I had learned about it many years ago and kind of just, thought it was an interesting concept. But as every time it gets kind of brought back up, I'm even more drawn to it because it really aligns with my own core values, which is that health comes from a lifestyle.
Mm-hmm.
Really, like it's so much more than just like going on a diet or practicing this particular habit to get this result. It really, when you practice health, it's a life philosophy.
Totally, totally. Well, think about it too, is how many diet fads have we been exposed to from the 90s to now? And none
Oh
of
my
them.
gosh. Well, I'm older than you, and in the 80s it was
Yeah.
horrible.
Yeah.
I was really little in the 80s, but it was, that was the fat-free decade,
Uh-huh.
which did a lot of harm to a lot of people.
Well, you have now the keto and the vegan and paleo and raw vegan, which I personally don't agree with doing long term.
Mhm.
None of those have really stuck. And, I listen to a lot of medical podcasts myself. And there are many medical doctors, DOs, Ayurvedic doctors that discuss that those people aren't sticking to those lifelong.
Yeah,
Versus
they're not
Ayurveda.
sustainable.
Um, Ayurveda, I would say if you see an Ayurvedic practitioner, Chinese medicine practitioners will mention your diet too, but it's not as heavily of a, I want you to do this at this time if you can.
Right,
I want you to try to go to bed at this time. I want you to poop at this time. What
right,
does your poop look like?
right.
What what are you eating throughout the day? How are you cooking it? What oils are you using? What spices are you using?
Mhm.
So I think Ayurveda does go a little bit further as
Yeah,
far as the honing in on that
yeah,
dietary lifestyle.
yeah. I think a
Uh,
good point to make too is that, just because something's 5,000 years old too, it's not static. Like
no,
they're not practicing the
no,
same way they did 5,000 years ago. Like there's
no,
this
no,
concept that
no.
these aren't sciences, right? There's this out there. There's this kind of feeling from the general public that's been, I believe it's been purposeful to create this thought around these types of modalities that they aren't science based,
Yeah,
right?
yeah,
And that they're static from the old day and they no longer apply. And that just couldn't be further from the truth, right?
yeah. So my teacher, perfect example, he is an OBGYN and an Ayurvedic doctor. So you have two
Nice.
perspectives. And when we
What
talk
a
about
nice
it,
compliment.
we talk, and that's why I chose him. I was like, yes, babies,
Yeah.
like work with me. Uh, so what he always says is medicine is the pursuit of truth. It's not if it points east or west.
Mhm.
And I don't know who is really creating the division between integrative complementary medicine. I don't like when they say alternative medicine because it's older than Western medicine.
Right. Good point.
Um, and treatments are based off of observations. And thousands of years ago, so Charak is one of the Ayurvedic original sages, and he has a Samhita is what it's called, like a collection of medical data and observation. And the first observations on plant medicine were being done on animals when they're sick, when they're wounded, if they're dying.
Yeah.
How is that different than doing a Western medical study on a rat?
Yeah.
It is not. It is not. And I texted
Yeah.
you earlier. One of my classmates, because I told them, I was like, oh, this is you know, the pseudoscience or whatever. But you go on Wikipedia, which we know Dr. Wikipedia isn't very truthful anyways, and it's just
Right.
a bunch of mumbo jumbo.
Yep.
But craniosacral work, reflexology, Chinese medicine, Ayurvedic medicine, chiropractic work are all considered pseudoscience, what is that?
What is that?
Yeah,
But that's my point too here, is like, this is purposeful. There's a discrediting factor to it.
yeah,
And I'm always skeptical when someone uses words to discredit somebody, and not just their data.
yeah,
Yeah.
yeah,
Right? Like, because your data should speak for itself. We don't need to label it and say, oh, that's stupid, or they're an idiot, or, they're motivated by, all that stuff. Like, you're red flagging yourself when
for
you do
sure,
that.
for sure.
Your data
Well,
should be able to uphold scrutiny.
it's like perfect examples. So I like share certain research on my personal Facebook and sometimes on my page. And people say, well, you don't believe in science. And it's
Yeah.
like Ayurveda means the science of
Of
life.
life.
So I am not believing in science.
Yeah.
My degree is in science.
Yeah.
Biology and chemistries is all I studied when I was in school. And I did take 2 semesters of nutrition. And that was, I think, the kicker to me now, comparing it to what we're studying, is it's like, this is good for you. This has vitamin A. This has vitamin K. Everyone should eat this. But
Yeah.
being able to eat is different than being able to digest and being able to absorb. And
Right.
that's what a lot of us have deficiency.
Right.
It can be because what we're feeding ourselves, but our
Mhm.
body is not able to do that because there's
Right.
obstruction in channels within the body.
Right.
Um,
So
the
you have
other
to work to open the body to be able to absorb and take in nutrients before you can, fix the problem.
Correct. And there's a lot of trendy Ayurvedic adaptogenic herbs, which I'm sure you're familiar with. One of them being ashwagandha.
Mhm.
Ashwagandha is an adaptogen where it helps hormonal balance. It's an aphrodisiac. It's
Helps
uh,
with anxiety.
anxiety,
Yeah.
stress. It helps you wake up. It can also help you sleep,
Right.
given adaptogen its name.
Right.
But not all of us should be taking that. And
Right.
that's more of a rejuvenative herb. And if we haven't appropriately treated the body and looked at the root causes of the symptoms, we shouldn't be rejuvenating. Because
Right.
if there is toxin, or ama is what we call it in the body, ama or toxin happens when your body can't digest. So then it becomes more sluggish, your channels become clogged,
Right.
and it's like sludge
Right.
in the body.
Right.
Um,
So that right there, which you just described, is the practice of science in itself.
yeah,
Right?
yeah,
I mean, you're
yeah,
observing, you're taking data, and then you're applying, based on that observation and data
for
on a
sure,
very individual level.
for
Right?
sure,
Like,
for
on a
sure.
very individual level. It's not some study that's been done on 1,000 people over here, and now we're applying it to you as an individual. This is based on a relationship that you have with a patient, and you're observing them, taking data from them, and then applying the right science.
Totally, totally.
Yeah.
And I had a mom recently, and it was such a beautiful thing. She's like, "This is the best I've ever felt. I'm changing my diet. I'm sitting in the morning before I wake up my 9-month-old, and um, is this all just a placebo?" And I said, "Well, if it is a placebo, it's a pretty damn good placebo." and uh,
Right.
and like, her goal is to help herself um, wean off, with her midwife support, an SSRI medication
Okay.
for anxiety. And she's like, "This is so good, whatever it is." And I really want to start to taper off with medical help, to see what it
Supervision.
can
Yeah.
really do for me. I want to see what these herbs can really do.
Yeah.
Um, I
How
can't
empowering.
I can't give, hey, stop your medication.
Right.
As much as we're having this conversation, I think Western medicine is a very, very precious medicine. If I
Mhm.
get hit by a
Yep.
car, if I
Oh,
get
yeah.
cancer,
Emergency medicine
um,
is top notch in this
I
country.
I really, really, really see it is a beautiful medicine in itself.
Mhm.
But there are a lot of cracks to it, And I
Yeah.
think it's failing us right now. And
Yeah.
it's failing us pretty hard in the sense that
Yeah.
um, why do we have the worst maternal health rates out of any other developed country? Why do 3 to 4 times Black women, why are they dying more than of white women?
Yeah. I
Why?
don't want to put you on the spot, but have you seen the new article that just came out? The new research article that infant deaths have dropped 30% since
Oh, yeah,
quarantine.
yeah. Yes, I have.
So infant deaths being like unexplained deaths, sometimes they call them
It,
SIDS, yeah, or failure to thrive, or these are terms that they use to describe like kind of unexplained infant deaths. Is that correct?
yeah. So it's a little controversial because I think people are coming from the lines of, oh, well, we're not getting in our car as much because we're stuck at our house. So
Okay.
car crashes are down. From what I have been doing reading with, and even um, talking to a lot of my clients, they're not bringing their babies to the pediatrician as much as what they were uh,
Prior,
before
before.
this
Yeah.
happened.
Yeah.
And a lot of standard medical procedure, which I consider a vaccination a procedure,
Hmm.
um, it's not well medicine.
Yeah.
Um, those are happening less and less and less right
Hmm.
now during
Well,
this.
medical, no matter what we, can say, we don't know exactly what it is that's causing the decrease in birth, but we do know that the medical visits are down,
Yeah,
right? A medical interaction face to face with infants is down,
yeah,
period.
yeah, yeah.
And the deaths are down. So
So
that's the data. I don't
yeah,
know how you want to interpret it, and I'm
yeah,
not here to interpret it for you, but that is the data at this point.
yeah, yeah. And from the medical standpoint of like correlation doesn't mean causation, but
Hmm.
um, I really have to hold space for those that are only wanting to do everything their medical provider tells them to do. And
Yes.
then I have to help people that question because they have been let down.
Right.
So I have to hold the space for the
For
full
both. Yeah.
spectrum.
Yep. And
Uh,
and and I value that perspective so much because to me that's what it's all about. I'm
mhm.
not wanting to spread information to make people more fearful or make people change their minds. I am wanting to spread information to so that people can make informed decisions because I do feel that it's a little bit out of balance here. There's a suppression of information.
Yeah,
And so, that's my contribution is trying to just bring a little bit more awareness to the facts. Now, what you do with that, that's completely up to the listener and anyone, you know.
sure.
But I will say this in addition to that is that you tend to not pay attention to things until it affects you directly.
Totally. And personal experience with something is something that um, is more powerful than any study.
Right. Like for
Talking.
me, I suffered for years with excruciatingly painful menstruation after I had my daughter. And
Mhm.
nobody had any answers for me in the allopathic field. They were willing to take my uterus out so I could go through, menopause right away, overnight kind of thing. And something in my intuition was like, that's going to create more problems than you have right now if you do that.
Uh-huh.
So I held out and it was awful. The pain was horrible. I'm not talking about like curl up with a water bottle and just lay down and relax. No, this is like labor every month. It was horrible. And thank goodness I discovered acupuncture after many years and
Hmm.
Chinese medicine. And along with that and CBD, those were the two things for me that, locked it in and it healed.
Yeah. Yeah.
And so to not have that exposure out there for people to know that this is available is frustrating to me because there's a lot of unnecessary suffering because, they have a different agenda out there.
Yeah, for sure. Um, it's a hard spot to be in, because I work in the hospital and I work with midwives, nurses, doctors, but I also am coming at it with a different lens. And um, I want to be like a safekeeper of their rights and their medical freedom and informed consent.
Mm-hmm.
Coercion is not informed consent. And sadly, I was sharing recently with a friend. Her friend is finishing medical school, and I was sharing our family's personal experience with feeling shamed within the hospital, with feeling shamed with our former pediatric,
Mm-hmm.
with our former pediatrician saying, your baby's condition has nothing to do with your diet and your breastfeeding the baby. And I like bawled my eyes out. I was like, what the hell? Does that make any sense? It does
Right.
not. That doesn't sit well with me.
Right.
My diet has nothing to do to affect my son's autoimmune disease. So I left there and I said, okay, I want to do some research here. We only have one pediatrician in all of Boulder County that used to work in a hospital, now has a private practice. That is so amazing in the sense that the hospital wasn't looking at the nutritional composition and biochemical composition of each kid and saying, this is appropriate for them, or try these modalities.
Right. Mm-hmm.
Why knock it until you try it?
Yeah.
And he has been, I don't know, every parent wants to feel good about their decisions with their children.
Yes,
But I
of course.
don't think it should be, you need to get permission or approval of your medical doctor. They aren't Jesus. They aren't God.
Right. Right.
Science changes.
Yeah.
Practices change. It takes 20 years for evidence-based research to be put into practice.
Yeah. I
Which
think a
is
lot of people don't understand that, especially with the current model. We're so desperate for answers as a society. We just need an answer.
an interesting parallel is a lot of these providers are working 12 to 24 hour to 36 hour to whatever shifts, and they're working their asses off.
Mm-hmm.
How is that helping their immunity right now?
Right. No sleep.
Like, not being able to tap out,
Yeah.
not being able to have regular circadian rhythm.
Right.
That's disrupting immunity.
Right.
And
It's interesting that,
I respect all they're doing, but I'm worried. Okay, a
yeah.
provider that hasn't slept at their house for 2 days is doing this medical procedure right now. We're not
Right.
superhuman. We're not bionic.
Are they overworking because there's this rush on COVID? They're overrun with COVID patients? Or are they overworking because a lot of medical staff has been furloughed?
So I can't really speak for the ER people, but I'm working with a small group in labor and delivery.
Right. Right.
At one of our hospitals here, every single mom that goes there has to get tested, whether
Okay.
it be right when she pushes and gives birth or after. Another
Okay.
hospital, they're not requiring testing, but they're screening you. Another hospital, they won't even let me in the door. And they're not letting their patients bring any belongings into the hospital right now because of fear of this.
Right.
Which is also interesting because they're letting those moms being screened and fathers and, whoever, being screened through the ER. Like, I want to know these higher ups in the hospitals, why can't you screen them in the front door? Why are you screening them at the most sickest part
Right.
of
Where
the
people are coming in with symptoms or
Yeah.
supposed to be. I mean, that's
Yeah.
where they would present, right?
Yeah. And when this first started, I was like, I don't want to walk through the ER either. I'm not pregnant. I don't want to go there if I don't have to.
Right.
But if this was really such a big concern,
Mm-hmm.
why wouldn't they just say, okay, we don't want any pregnant person. We don't want anybody that's
Right.
not coming to stay at the ER go through the ER.
Right. We're going to designate a separate area to keep these women well.
Yeah. And this is after hours, mind you. So the hospital's closed.
Yeah.
But why can't you just call up to labor and delivery and say, hey, can you come down and come get us right now?
Right.
Can you come down from, the second floor and get us?
Right.
So the L&D, the great, beautiful thing is that they're away from the emergency room.
Mm-hmm.
They're usually, labor and delivery is on the third floor or on the second floor in hospitals, and an emergency room is on the bottom. So there is a degree of separation.
Right.
I haven't had any positive moms. My colleagues, I work with a group of doulas, and they haven't had any. There are some doulas that are choosing not to work in the hospital right now. But my perspective, we all can do what we're comfortable with.
Yes.
If you don't feel comfortable going into the hospital, I totally understand you. But these people need it more now than ever.
Right.
And there's also some theory in the birth world of these hospitals that aren't allowing us in. There is statistics that show that we lower medical intervention. When you have higher medical intervention, a hospital can profit more.
Right.
So is that also another reason why we are not, allowed at some of these places?
Right.
And who knows when we'll be allowed back?
Well, there tends to be a bit of a culture to a hierarchy with a doctor. The doctor's up here, and all the support medical staff seems to kind of be down here in some cases. Now, I'm not talking all doctors. There are some really great doctors out there that are very cool and receptive, and they are there to work as a team together and aren't offended by outside opinions or suggestions or experiences or whatever. But I have had interactions with medical doctors where if you so much as question the way they're doing something, they're going to kind of get mad and belittle your opinion. And so I can imagine having a doula in there who has, tons of birth experience and helping people through this process. If they want to, and tend to think a little bit differently as far as a more natural approach to giving birth and what matters and what doesn't matter, is a little bit different life philosophies there. I could see how that would be motivating to not have you there from their perspective.
So let's look at the history of OBGYN, male predominantly.
Interesting.
Treating women, older white men, treating all of these women.
Right.
So a lot of different over the years with reproductive medicine and contraception and all of that, it is a little bit experimental given minority.
Right.
Not saying all men that are obese are not excellent communicators or, not seeing women as equal or, are in a power trip role. There are amazing OBs that I have worked with. One of them just retired and was the only OB in Denver to do breech deliveries that felt comfortable doing that. And that's like not even a thing. But
so if your baby's breech, most of the time they'll just go right to C-section.
Yeah.
But you would actually give it a go.
Yes. And work with people, and aversion is what they do to try to manually
flip the baby.
Turn the baby. Acupuncture is also another powerful tool.
Oh, I didn't know that.
Even the physiological body positionings that can help align the uterus with the pelvis and give the baby a chance to move, which is positions that moms can start at about 20 weeks that really help elongate the uterus, and at the end of pregnancy help with optimal fetal positioning. Now, so if moms have an uncomplicated pregnancy, are healthy, I'm honest with them and say, have you chatted with a midwife? Have you chatted with a midwife in a birth center, hospital, or home birth setting? If someone's not comfortable giving birth at home, the beautiful thing about the hospital is that they have all the tools there that we need, especially if a baby needs NICU support. Which is so beautiful to be in a place where you don't have to transfer, you don't have to get into a ambulance and buy time. That doesn't often happen, but if that's making you nervous, and a mom can have that awesome birth experience in a hospital with a midwife that's going to get to know you more, longer appointments. You're not just at a deli counter picking your number and going into your appointment for 10 minutes and,
Right.
having a quick in and out.
Right.
I was with an OBGYN practice. I switched and I was like, what the heck? This is like day and night. This person knows my partner's name. This person knows what I do for work. This person knows my health history. This person knows how much I exercise.
Right.
And it just was a night and day
Which
difference.
is so interesting because, all of science, right, is based off of cause and effect.
Yeah, totally.
But yet they're saying what you're eating and what you're putting into your body doesn't matter. So it's like it doesn't add up to me. How can you, because what you're eating, your body has a reaction to what you eat. It digests it, takes nutrients in, like it affects your cells.
Mm-hmm.
So how could that not have an effect on your health? And then in your case, you're breastfeeding your son. So you're passing a bit of your health on to your son. And
For sure.
so the cause and effect, if we really look at this stuff here, we have to wake up because it's not making any sense.
Yeah. There's some beautiful IBCLCs. They're international board certified lactation consultants. They have more lactation support than a pediatrician does. So why is a pediatrician giving mamas
lactation advice?
Support?
Yeah.
There are foods that are galactagogues or milk producers. There are spices and herbs that are galactagogues and milk producers. Why are we feeding tuna sandwiches and Jell-O and salads to postpartum
lactating women
in the hospital?
Mm-hmm.
And I hate to think of it like this, but when you're in the hospital, say if you have a procedure and they're giving you that, and then you say get an infection, then it's a vicious cycle.
Right.
Of, okay, and now we're going to give you an antibiotic. And there is being research right now that your microbiome is disturbed for up to 4 to 5 years from a course of antibiotics.
Wow. I didn't realize it was that long.
I just read that recently and was like, holy cow.
Yeah.
I've been on
and I know people who have been on antibiotics multiple times a year for years because of chronic lung problems or chronic bronchitis or chronic, because that's treating the symptom. Again, we need to find out why you're getting lung infections. Why are you getting bronchitis? Mm-hmm. The whole approach is it doesn't aim to heal. It aims to, soothe. Maybe we could give them credit for that. Soothing.
When we're looking at somebody, we look at the root of the problem, the symptoms, and then the therapeutics and modalities. And doing that by looking at somebody's eyes, their nails, mm-hmm. their tongue. Right.
Which shows the reaction they're having.
Yeah, organ palpation. The skin is the largest organ that shows us. If you have somebody with hormonal issues, a lot of times they have a broken out face, not clear skin.
Acne.
It's so hard now because, people ask me look at me, tell me what's going on.
Yeah. Oh yeah, I would.
I'm still learning. I am still in school. So I'm certified as a prenatal and postpartum Ayurvedic support person. And now I'm in an Ayurvedic practitioner program that I can decide to do a doctor program of that and do an extension. But Corona has really interrupted with it all because we were planning to go to India in November to treat patients there.
Oh, fascinating.
But I have classmates all over the country that were flying here for clinicals, and we would have student clinic, and we would literally see patients for 9 hours of the day and have them come, and we would do a round table with our teacher there. Wow. It was so cool to look at that. We had one person with I think artificial valves in her heart, and we all palpated her and took her pulse and looked at her eyes, her skin, her hair, got her on the table. And all of us were like, she has severe heart issues, and she didn't really disclose them in our intake. And then
Oh, wow.
finally said, oh, I have this heart problem. And we said, oh, well, where are you living? And she said, I'm living up in higher elevation, which is more likely to have air imbalance within your channels.
Right.
I said, okay, that makes even more sense.
Right.
You're living in the mountains, in the cold, not very nourishing,
Right.
dehydrating, hard on the cardiovascular system. And then she told us, oh, I own a ice cream truck company. And we're like, oh, ice cream in the mountains. Okay, that's okay. Like, I am drinking an iced coffee right now. Usually we shouldn't be drinking cold things because it causes our body to work twice as hard to heat it up. And then it's hard on our digestive system. But it's like 80-20 rule. Like we only live once. And for some of us fiery people in nature, colds can be okay in moderation. Yeah. But when that's all you're used to, then it can lead to dysregulation.
Right.
Well,
let's talk about that a little bit, because I started, reading some stuff and just found it so interesting about Ayurvedic medicine. And can you explain to us, because from what I learned, there's a dosha, right? We all have dosha. Yeah. We all have a dosha. And I just love that they kind of talk like, what's your dosha?
Yeah.
Very
There's
cool.
Quizzes online that try to.
Yeah, I saw that quizzes
and look at you and tell you what your dosha is. But in actuality, so all of us have all three of those doshas. So we have vata, which is more air and ether. So it's vata would govern circulation, nervous system, lungs, elimination. So think of movement. Vata is or wind, which is vayu, is life. We all need air in our body for daily functions to happen. But when they become vitiated or imbalanced, then health complication occurs. Viruses. Mm-hmm. Imbalance in vata is viruses. Coronavirus, perfect example. Trouble with elimination, constipation, bloating, gas is another link. PTSD, anxiety, depression, imbalance of air within the brain, within the mind. And tying into, this is the only medicine that looks at the subconscious being, that looks at the conscious. Mm-hmm. It's conscious based for preventative medicine.
Yeah.
So the vata people are usually skinnier. You can see their veins. Their skin can be kind of like translucent. They don't usually have oily hair or oily skin. Very dry. And most women in Colorado are vata imbalanced because we live in a high desert alpine climate where it is dry, even though it is hot. We don't have humidity. Most of us are dehydrated. Mm-hmm. The pitta people, it's fire. It's fire and water. And the pittas are myself. Dark hair, dark skin, medium framed, usually athletic people. Think of everything digestion. So the pittas have very strong digestive fire, or agni. And that is the whole purpose of Ayurveda, is we are saying that digestion is the root of the disease. And now you have Western medicine doing studies and saying, oh, you have a microbiome. And your microbiome...
gut health.
Yeah, and it's like newer concept for them. But this has been...
5,000 years ago.
Reading it in school, I'm like, whoa, they were some like far beyond their years discussing that. And now we know the vagus nerve, which runs through the digestive system, which then runs to the brain, and their gut and brain connection. Then we have the more kapha type, and kapha It's more of the stability of the body, the fluid of the body.
Okay.
So when that is imbalanced, obesity tends to occur. Channels aren't able to flow as fluidly like vata would be.
Okay.
Your kapha is essentially your immunity. It's responsible for our vigor. So a kapha stage of life would be a child.
Okay.
A child is more kapha than we are. Moisture to the skin, luster to the beautiful hair, skin, nails. That's kapha.
Okay.
And we all have those in our body. So
Right.
I think a lot of these tests that say like, oh, you're a this or you are that.
Right.
We all have those, some
Right.
more concentrated and higher than others.
Right.
That is biochemistry at its finest. Looking at the chemical composition of a person, looking at the chemical composition of a plant.
Right. And in Ayurvedic, you call that constitution, right? And we're born with that?
Yes. So at the moment of conception, Prakriti is our constitution before we are imbalanced. And then we're here and we become more imbalanced, which is Vakruti, which is what we have now. So your chemical composition at the moment of conception is not the same as what it is right now. Right. Unless you are a superhuman, healthy person, which none of us are. We're all working. We're all at working progress. Yeah. So that is pretty interesting as far as diagnoses, because if you have one of those doshas more prevalent or more imbalanced in your body, then there's a whole category and subtype of many different diseases that break down into, like I said, vata is a imbalance in vata leads to viral infection.
Okay.
Imbalance in pitta leads to bacterial infection, and imbalance in kapha leads to more fungal infection, which it makes sense. Fungus, when you have more, mucus or liquid. More liquid is fungi.
Right.
Creation. Moist, I should say. So it all is, that to me explains a patient in a whole other level.
Right.
And I like to say, when I go to the primary care provider, are they touching me? Are they palpating my organs? Are they looking at my tongue? Mm-hmm. They're looking at my eyes. Mm-hmm. Are they feeling my pulse versus determining that by a diagnostic tool?
Right.
Which we do listen. We use a stethoscope to listen to every organ. Mm-hmm. And we can tell by that if vata is moving freely, if the organ is weak, if the organ is the root of the issue. Right. So then we're treating dhatus or tissues of the body. So everything from bone to blood to muscle to reproductive adipose. Mm-hmm. We're then diving into that and we're addressing.
So when we're born with a constitution, that means, just so I understand it right, that we're like a little bit more like rooted in that particular dasha? Like we're more rooted in vata or pitta or kapha? And then we have to work to balance them. Correct. So they're two separate things. So like you have a constitution, but then you got to work to balance all three.
Correct.
Is that right?
Yes. Okay. So think about it too from a Western medicine perspective of epigenetics, and our outside environment has the ability to turn on or turn off genes.
Right. That
constitution is linked to epigenetics, and that pretty much is like, boom, this all makes sense. And this was trying to explain that. Our environmental factors imbalance us. Right. Whether it be our water, our soil, the season that we're in, and if we're not living appropriately, our daily routine, which is dinacharya. Yeah. So all of that um, is so, I don't know, it's so simple
Yeah.
that it's like, why are we needing to prove that this is a science when you can ask somebody, hey, if I'm feeding you this, does that make you feel less gassy? Does that make you feel better? How's your poop looking than if you're to eat takeout at a local restaurant where spices are not being used medicinally?
Right.
Most people don't know that if you open a cupboard in your cabinet and or you open a cupboard in your kitchen, excuse me, and you go through your herbs and your spices, the medicinal properties, that if you're using those things, they are playing into anti-inflammatory effect, hormonal balance.
Right.
If you have cardiovascular issues, can help with movement
Right.
through the body. If you're postpartum, can help stimulate and tonify the uterus.
Right.
Some of them are aphrodisiacs. Some
Right.
of them boost digestion. Some of them allow and ignite that Agni or digestive fire to catapult and happen.
Right.
So yeah, it's I wish more people within the hospital would look at this as one is not better than the other. We're all trying to do the same thing,
Right.
help people.
Right.
But there are some basic things that we can be giving them to have longevity.
Right.
We don't want a lifelong patient. I don't want to treat somebody their whole life. I want to
You
treat
don't.
somebody. No,
You,
no.
you yeah, you don't. And because your objective is to teach so that they can then take the tools that they've gotten from you and apply and then go off and teach someone else. Right? I mean, that's the whole power of it, is to, teach one person and they take the information in, right? Like it's expose, teach, apply, teach them, or, have them teach someone else.
Totally. And there's a Chinese medicine saying that really ties into this. So if you have a sick man that's waiting until he's sick to address his health, so he's sick and finally says, okay, Corona's here. Oh, I've been drinking a lot. I've been abusing my body. I haven't been eating well.
Mm-hmm.
I haven't been telling my body nice things. I've been,
Mm-hmm.
not appreciative of my temple.
Mm-hmm.
That is similar to a man who has a burning house and is thinking about, oh, well, I wish I had a well. It's time to build a well. I need to put out the fire. It's like, why didn't you have the well built before? So
I said this to my husband the other day. I'm like, I feel like I've been training for a pandemic for 20 years.
No, totally.
Like, why are people just learning about vitamin D, vitamin C, exercise, sleep, like washing your hands? Like, what? I've been practicing this stuff and teaching my kids this stuff for as long as I can remember.
Yeah, the herbalist community right now is like, come on.
Oh my gosh.
And there's the instant gratification of we are conditioned to say, here's a pill, take the pill. The pill's going to treat your headache or fever.
Yeah.
Well, when we're looking at fever, there's many different types of fevers and there's many different types of symptoms. Right. So then we choose the plant accordingly.
Right.
Pharmaceutical is good that it is plant medicine, but it is synthesized medicine.
Right.
And it's medicine that a lot of times the reaction of certain plants and the side effect of taking certain plants isn't looked into.
Right. Right.
And, that ties into, we have a huge opioid crisis right now. We have doctors that are killing themselves because they can't change this. One person can't change this whole policy or infrastructure. No. It has to be many, but when you're conditioned and educated in that way, it's so hard to break away.
Yeah.
And it's why in California right now, with a lot of mandates happening with health, doctors are saying, I don't want to practice anymore. I don't want to be at the will of the insurance companies. I don't want that to put me under scrutiny if people are not doing these things.
Right.
Or people are choosing for their own well-being. And I always say, like, if something is being so forced or coerced, you need to do this. This is good for you.
Mm-hmm.
That makes me a little skeptic.
Yeah, right off the bat. And I think the way we tackle this, because like obviously big pharmaceutical companies, they practically rule the world here.
Yeah.
You know, and so fighting them is not the way to shed light on the issue. That's a way to shed light on fighting, because they will
Totally.
wrap you they
Yeah.
will wrap you up in fighting, and mudslinging will become the spectacle. What we
Well,
need to do is educate and then vote with our actions. We have to stop buying crap. We have to stop buying pills that make us sicker. We have to start spending our money, even though it's uncomfortable, because we have to have insurance. We have to have it, right? We've been programmed that we have to have it, and we don't use it. My family and I do not use our insurance. We pay
I
out of
didn't have
pocket.
insurance for a few
Yeah.
years because I was like,
There were many years we didn't have insurance.
yeah.
Because we were paying out of pocket for the treatment that we wanted,
Mm-hmm.
right? And that may seem risky, you know, to do that. But when it comes down to it, whether you're going to be able to afford to pay your premium or afford to get the care that you know will help you,
Mm-hmm.
then you do what you have to do. But when more of us, you know, decide that we're not going to buy the fast food, we're not going to buy the plastic products, we're not going to feed our kids, you know, 80 grams of sugar before they leave the door in the morning to go to school,
Yeah.
that's when the product makers will be forced to change, because no one's buying their product.
Uh-huh.
And we don't need a big fight about it. We
No.
can quietly not buy your product. Doesn't make a sound.
The, the two infrastructures that need to be dismantled from the ground up, in my opinion, are schools and hospitals.
Yep.
Because schools are temples. Schools are, you know, a sacred place, or should be, I should say.
They're not anymore.
It should be a
Yeah.
sacred place for children and for development. And, you know, I thinking about.
And parents should not be the enemy in a school.
No. And showing up and saying, okay, well, you know, here's what you're getting for lunch is frozen chicken nuggets and, you know, chocolate milk that has 35 grams of sugar in it.
Mm-hmm.
And
Now go learn. Go sit and learn.
bouncing off the walls, and then they're like, oh, you probably have ADHD.
Yeah. And we're going to start at 7 a.m. because we need to be done by 4. And it doesn't matter that you're a teenager and you're not even firing your brain until 9 a.m. It doesn't matter but it's all about the kids.
Yeah.
It's clearly not. This is why I pulled my kids out 3 years ago,
Uh-huh.
you know, and that's a whole nother podcast in itself, but it's not nurturing a climate where it's a community where parents' input is valued. And I'm not saying they have to do everything that the parent wants, but there needs to be balance here. And when I was dealing with a school, I felt like I was dealing with a mafia.
Yeah.
Yeah. It was like, we're going to cut you off at the knees, lady. You'd better shut up.
Try being in Catholic school from kindergarten through college. That's what I was in. And it was fear. Everything was like, don't do this, or this bad thing is going to happen.
Right.
And I think my parents did it, you know, mainly for the discipline aspect of it. But I grew up not knowing a lot of different things. Most kids in our class had no idea what sex was or how that like makes a child, or that sex doesn't happen just when you have sex. Like you need to be ovulating.
Right.
Ovulation. So, you know, there were a lot of things that we did not learn, as far as you need to pick a major. You need to do this. It's like, I haven't even, you know, walked into a laboratory and worked in a lab for 9 hours.
Right.
I did, and I quit. That was my first job out of.
Because you hated it?
As I worked under a lab hood in a European-based company in Cambridge, Mass. And I was like, oh my God, I cannot listen to this is when iPods were things. I can't listen to anything on my iPod. I'd like to listen to everything. So
Yeah, we don't expose our kids, like get out there and see what it's like to see if you even like it.
yeah, I hated it. I was like, I don't get to talk to anybody. I can't actually see that I'm helping somebody.
Mm-hmm.
There's research companies purchasing the kits that we're putting together for them. Yeah, no.
Yeah.
It's hard. I think our children, helping them be in tune with their bodies so that they can be their own healer.
Mm-hmm. And that's where healing starts, is within you. I mean, that sounds cliche to say that, but seriously, you are the most qualified to research, apply, and you are the one that has the drive to to get healed.
Yeah. Well, if you tell, the media these days that they say, okay, you critically think, you're a conspiracy theorist.
Yeah.
You're
That's right.
doing this research on your own body and what you're doing. You're not a medical doctor, so you just think you're an expert, and now you're doing all this stuff.
Yeah.
And my friends and I, that Chinese doctor friend, naturopathic doctor friend, and it's like, okay, well, just because we're not medical doctors,
Mm-hmm.
why is that discredited? Why is that put on a pedestal? But the Western medicine complex is white European descendant money.
Yeah. And clearly they don't even apologize for the money part of it.
No.
They make advertisements on TV. People see the advertisement, they go to the doctor and they ask for that prescription.
Yeah.
I mean,
yeah, and that's why a lot of there's articles out with doctors killing themselves because they have gotten somebody hooked on opioids, and that person keeps coming back and threatens them because they want their medication, because they need to have their medication. Yeah. And then it puts the doctor in a tough spot. One of the teachers that I have, she's an Ayurvedic doc and has a clinic in New Mexico. She said that the numbers are around 2 to 3 medical doctors are killing themselves a day.
Wow.
I don't know where she found that, but that is a lot. And if you have access to those different things that are going to alter your brain chemistry and to help you to stay up longer, or to help your anxiety, or to help you sleep. Oh, I'll just take a Valium to sleep, or whatever. So yeah, it's the prejudice, I think, of studies. Why in America do we say, oh, it's only legit if it's from the US or from the UK? Why don't we take this study into consideration if it's being done in India, if it's being done in China, if it's being done in some of these less developed European, or even, say in Africa? Yeah. So that to me is prejudice in itself, and then it ties into our current issue that hasn't really ever gone away. So the prejudice of studies from other parts of the world. I don't think it has to be done here in the US for it to be like, oh, okay.
Valid. Yeah.
And if you do look, so on PubMed is my main go-to, there are
it's amazing how much information is actually on there if you look for it.
Yeah.
But you have to look for it.
You gotta dig. You gotta have a lot of time.
Yeah.
And not a little child like myself. Or double-blind, randomized, controlled studies on the biochemical effects on the body of various plant medicines as helpful with preventing contraception.
Yeah. Do you know there's a gal, and I wish I could remember her name. Maybe we can put it in the show notes. I heard her talk on a podcast. She has actually invented a non-hormonal birth control.
Oh.
Do you think anyone's heard of it, or she can get it to market? Nope.
No, I haven't heard of it. Yeah, and it's my last go with it. As I post birth, I said, okay, I'm going to try this copper IUD. I'm going to see how this is, and it was horrible. A lot of women I talk to that have had a copper IUD say the same thing. I bled like a pig.
Yeah.
Um, or it was painful, and then you see now these class action suits with IUDs that have been dislodged,
Mm-hmm.
IUDs that have been dislodged in the uterus, somebody's IUD in their stomach,
Mm-hmm.
and now there's these lawsuits for that, and then lawsuits with
Yeah.
what is it, Mirena?
Yeah.
Is that
Marina. Mm-hmm.
Mirena, the controversial one?
Mm-hmm.
So when did diet and that uh, the whole, I don't know, uh, truth of diet being our building blocks, when did that just be disregarded and thrown out the window?
Many
Um,
years ago. And there's, if you get inclined to research it, you can easily follow the money
mhm,
and see how this transpired. But I'm hopeful, because I do feel like, I'd love your perspective on this. Do you see a shift? We actually met at a rally,
mhm,
right? We met at a rally where Robert Kennedy Jr. spoke about a new bill that's just been passed here in Colorado about consent and not having the option to opt out of mandatory vaccines. That's how we met.
mhm,
And I have to say that that was such a great day and such a wonderful expression of protest and people thinking critically about decisions for their kids. And there was almost 3,000 people there.
yeah,
So
yeah.
what's your take on the climate of people and how they're changing their viewpoint on Western medicine?
Well, if you look on a lot of these bigger herbal companies, a lot of the herbs are out of stock right now for immune boosting supplementation because everything that's happening.
Oh,
Uh,
interesting.
the essential oil market, which I don't use essential oils personally, because I think it's wasteful to the plant, because they're using so much plant to make an essential oil,
Mm.
um, where you can use
Kind of
every
like juicing, eh?
yeah, yeah.
Like you have to use so much.
And
My
then
husband was juicing celery this morning. He goes, "How many stalks do I have to put in here?" I'm like, a lot.
you could use that fiber to bake. You could make
Yes. Well, we give it to our chickens, but yes, you can.
um, but yeah, that's a perfect example right there. It was happy for me to see all those people. Uh,
Yeah.
they're really, encouraging others and those, above us that are representing us, that we all have medical autonomy
Yeah.
of our bodies, and that it goes back into that. Hey, every mom and dad, if they have an intuition and an instinct, and we really need to respect that. And
Yeah.
we should be questioning that, because that interferes with their confidence to parent. Um,
Yeah.
and I felt that with being told some of these things in the hospital, and everybody says something different. And I'm like, I don't even know who, all this contradicting information, like nurses and staff, this is too much.
Yeah.
So there is a shift, and looking at plant medicine, a lot of these plants are cheap and easy to grow. We don't live in an ideal climate for
For
a lot
growing.
of the herbs and spices and plants that I use.
Mm-hmm.
More tropical climates
Mm-hmm.
do. Asia, India, Hawaii, like those wet, humid climates.
Yeah.
So that's good that there's people, online buying all those things, but that's also buying into that instant gratification. I'm taking these pills and it's going to make me better,
Right.
but I'm also eating uh,
Good
Mc-
point.
Good Macs or
Yeah.
Big, whatever they're called.
Yeah.
I'm eating these pills. Uh,
Yeah.
with the excess of supplementation, and a lot of providers, I bet, could speak on this, but these pills that we're taking, that's really heavy on the liver. And the liver is the biggest detoxifier of the body. And
Right.
when we're just taking these things pill form,
Mm-hmm.
it can be way too much.
Right.
Um,
Such a good point. Like, this is a science, and you do need a practitioner, right, to help guide you until you've got the swing of things and you understand this is a lifestyle and a philosophy that you have to practice in your life if you want full benefits of it,
Totally. Well, and
right?
I have been telling a lot of my prenatal and postnatal clients, anything I'm recommending to you, don't Google search it, because they have no idea in the application of the herb. And that's same with Western herbalism.
Hmm.
Like it would say, I'm like, don't take this. Oh my gosh, this is gonna, cause this or that to happen. And ask somebody who is or who has lots of training
Yeah.
in it. Um, and a lot of this, unless you know Sanskrit, you cannot translate
Right.
text and apply it. I
Yeah.
don't know Sanskrit. Next year, I'm taking it. A lot of the students that I'm in class with, a lot of them can do a good job of
Hmm.
translating, but our teacher translates for us, and then we go through.
Right.
Uh, but yeah, Google can't translate, and they don't also have access to that literature.
Right. Right. Speaking of the protest, I don't know if you saw, but I'm supporting Audrey Herman for District 34. She's a powerful gal that,
Today to
it-
pass with you.
yeah, she was on the podcast. And so she's running in the primaries and June 30th coming up. And she really is all about freedom and medical freedom. And I just wonder what your thoughts are with the like if she doesn't get elected and we continue to have our current representative in there who is motivated by
Money.
something that doesn't that thinks it's totally okay to take away our freedoms. Where do you see this going if we do get mandated to vaccinate? What are your feelings about that, just from your own perspective of your experiences and all of that? What do you see happening?
Um, so I keep reading more and more peer-reviewed studies that have come out about CDC recommendations for vaccines. There's a good study from McFarland. It's 2019 on looking at 3 vaccine schedules. And my husband and I both read it the night before the rally.
Mm-hmm.
Mind blowing to me that a 2-year-old has more or gets more aluminum than what a safe level is for an adult.
Yeah.
That's what this study was looking at. And the safe levels and having all these so close together,
Mm-hmm.
with that aluminum toxicity looks like,
Mm-hmm.
and where that is stored, and oftentimes it's stored in the brain.
Right.
And it's so controversial because a lot of people think, oh, overnight autoimmune disease has just happened. When I was growing up and, coming from a family of educated people, there was no talk of autoimmune disease.
Nope.
Even reading,
Never even heard of it.
Ayurveda, 5,000 years old, there isn't much talk of all these different autoimmune diseases that are happening. And I believe it's about 54% of people now have an
Have
autoimmune.
one.
That's half of our population.
Yeah. 1 in 22 boys now in New Jersey has
All that.
autism.
Yeah.
1
And
in 22. We don't have 1 in 22 with corona.
no,
So like put that into perspective. This is an emergency. 1 in 22 boys has autism or is on the spectrum. That's an emergency.
totally. I can't, I'm not qualified to give medical advice to any of
Yeah.
people, so let's just make sure that. But the interesting to me that we're giving vaccines to pregnant women when we're telling them not to have fish because of mercury content, which I'm like, have you actually read the contents that are in the vaccines?
Mm-hmm.
We
Mm-hmm.
have, chicken and cow DNA, mercury,
Peanuts.
formaldehyde, peanuts. They're saying glyphosate, which is in a lot of our fertilizers that those animals are feeding on, and then the animals get it, which then
We're finding glyphosate in our own tissue now.
Yeah. Yeah. So I am just very questionable. I used to be I'm not anti or pro. I do what's best for your family. I
Yep.
used to be very for like, yes, we should do this. This is the
Yep.
good thing to do, and everybody should be doing this to protect others.
Right. And I find that a lot of people who have immigrated here are the most outspoken about what's going on because they've been through stuff like this before.
Yeah. Yeah.
And they came here to get away from that.
Uh-huh. Uh-huh. I have friends that live in Mexico. There was a while I was entertaining moving to Mexico because the culture of Mexico is similar
Beautiful. Yeah.
there's people that are getting arrested for surfing. There's people getting arrested for being on the beach. If you are looking at research with COVID, mortality goes down with increased vitamin D.
Yep.
Then why are
Being
people
outside.
policed for being outside, and why is it only recommended on the news that we stay outside for 30 minutes? Oh, get your exercise outside for 30 minutes. I've seen like a
Wow.
thing. I was laboring with a mom and we had the news on, and I was
Yeah.
with them for 2 days, and it was a couple running, and it said, oh, make sure get outside for 30 minutes of exercise a day. And I'm like, why are they saying 30 minutes?
Yeah.
Like, why can't they be outside all day?
Yeah. The language is so intriguing to me right now because I feel like the language is very purposeful because you can turn on a TV and hear the same phrase. Stay
Oh,
home,
you know.
save people, you stay home, save lives,
Yeah.
right? A mask is showing kindness, a mark of kindness. There's common threads in language that it's just mind blowing to me because we use repetitive phrases have been shown to be used in conditioning.
Yeah.
Right? It's conditioning. And why don't you just stick with your facts?
Yeah, because they're also connected with the for-profit businesses
Mm-hmm.
and all that. And what really blew my mind the other day, and I'm just going to call them out because I would love Whole Foods to, address me on this. I was cooking for another doula, and her family's been buying food for me because she feels good, and she's like, oh, this is so great. And, we don't have to get takeout, and we feel better, and we have, a bunch of food to eat here.
Yeah.
In between every single use, they are spraying the conveyor belt. I don't care if it's not bleach.
Yeah.
It's non-toxic, but I don't put my produce in the plastic bags because I don't want it to be sitting in a plastic bag.
Right.
Grab it. And it was wet, covered in the cleaner. And they said, oh, you can put your produce on there now. And I just was like, I don't want to do that. I'm,
whatever you just clean that with, I don't want that all over my food.
This isn't organic food anymore.
Yeah. That's right.
And, people might say, oh, well, that's just a first world problem, whatever, at least you have food. But it's like, we all are working to pay for what we're buying.
We're getting. Yeah.
And we're getting. And
we're purposeful with it. We're making decisions purposefully, backed by our own education and our beliefs.
Yeah. And, there's a woman standing outside of my favorite coffee shop in Boulder that they're like, this is so hard. We can't have anybody in here because we have to hire someone to bleach and sanitize the tables and chairs after every single use. We can't afford to do that.
Yeah.
So they have this woman standing outside that has this company where they used to sell all this organic food to the restaurants, but now the restaurants, a lot of them have gone out of business or keep going. So they're selling a huge box of organic food for $25 with a lot of stuff in it. And usually the pushback that I get is, Alyssa, I don't have money to eat like you. And
Right.
the thing is lentils, which is a big part of the diet.
Cheap.
When you look, say, at Mexico, beans and rice is a very cheap
staple. Mm-hmm.
Staple. Lentils is a big staple within plant-based food and diet. Yes, I do eat meat once or so a week. That's high quality. But lentils are like $3 a bag for an organic bag.
Yeah.
Let's get crafty. Let's go to the small Indian stores, the small Indian markets that have organic spices, huge bag for $7 that will last you the whole year.
Yeah.
That's a lot cheaper than going to King Soopers, the Walmarts, the Whole Foods, whatever. Like, you're supporting somebody's family that owns a small shop who is, trying to make do right now.
Right. And it's a win-win because you're getting way more for your money. You're getting, and ultimately, even if I disagree with that argument that, I can't afford to eat healthy. Well, then you haven't reached the level of knowledge to know that you can.
Yeah. And it's giving people the tools. And that's what my whole goal is giving people the tools so that they can explore.
That's right.
Most of the people that I work with don't know about most of these foods. I had someone recently that's never had a lentil in her life, has never had beets, has never had coriander, cilantro. And I was like, wow.
Oh, wow. I had a kid at my house, a friend of a friend's kid at my house visiting for a party one time, had never seen a peach.
What?
Never seen a peach.
Oh, wow. Okay.
We're talking like 9 years old. Never seen a peach.
Wow. Okay.
So we pulled out the pineapple. We pulled out peaches. We cut up all this fruit.
Play with it. And there was a really powerful street artist last night, and he was painting something of us holding food, an arm holding food. I think it was like wheat or something, and a sword cutting that arm, which right now we are all fighting with our environment.
Yeah.
We're not living and adapting with our environment. We're trying to change our environment so that we can live with it versus us trying to change to live in it.
Right.
The natural
and I think it starts with our food source. I've had this conversation with people before. Like, think about it. Like, when you're eating junk and putting junk into your body, you're not thinking clearly.
No.
You're not thinking clearly. You're distracted. When you don't feel good, you are distracted. If you've ever had a headache in your life, you know how hard it is to ignore that. You can't. You're not firing on all cylinders when you feel crappy. So our food is such a powerful, and our health is such a powerful controller because when we're not feeling good, we're not operating, and we can't question, we can't critical think. We don't have time to spend on learning how to heal or whatever when we just don't feel good. So we have to kind of make a paradigm shift at the way we look at it. We have to start with our health and think, okay, I need to get this in order first. Start putting in good fuel so that I can operate at the level I need to in order to make better decisions in other areas of my life.
Mm-hmm. Yeah. Yeah. It's a interesting time. I thought that more people would like catch on this train of like, oh, like I want to, try to build my garden so I can grow some food and share the seeds with my neighbors and, help their children start to do that, which we've done here on our street. But when I look online, which I don't even like going on anymore, a lot of people are asking, well, how have you avoided this virus? And most people are saying by luck. it's luck. And I don't really think it's luck. I think that it's hard because those who have suffered with different things are often being affected more heavily. Yes, there are some healthy people that are getting this.
Mm-hmm.
I've talked to a lot of people that think that they got this months ago.
Yeah. I've talked to a lot of people
which I think I got it in January.
Mm-hmm.
Our whole house was sick for 3 weeks. And I think it's also bad that the, society is making it look like, oh, if you're sick, you are a leper. Don't go near.
Right. Oh my goodness. Some heartbreaking stories of a gal who was waiting outside of a store to be let in because they were only allowed a certain amount of people in. And she had to have a mask on. And she actually fainted in the hot sun and fell on the asphalt and burned because the asphalt was so hot. And no one helped her.
No? Wow. Okay.
Because they were afraid to touch her, I guess.
Mm-hmm.
I'm not really sure why. But so there's a definite change. And I think that's really, really being overlooked right now. The effect of fear on our culture. And how, in the name of safety, how far do we go? Right? With this, because it's really affecting our culture. And ultimately, who pays the price is maybe not you and I, but our kids.
We're going to have a hell of a next generation of immunocompromised and antisocial children.
Right? We're sanitizing everything where our immune system doesn't have to work as hard as it normally has to, which strengthens it.
Yeah. A kid's microbiome is maximum by 3 years of age. I have almost 3-year-olds. During all of this, I'm like, get dirty, go outside. I don't care if you play with other children outside. We're looking at the pediatric numbers,
0% death rate.
So I am fine with my child being around other kids. I don't want him to be growing up and, no, you can't go near other children. Mm-hmm. If another family wants to do that, that is fine. We respect that. But we continue to do what we would like to do.
Yeah.
Because I'm more concerned about my child's emotional and mental health. Mm-hmm. A lot of people's mental health has been tanking through this.
Yes.
Because if you can't feed your family and you're being shamed because you're trying to feed your family, but if you work in a place that's not necessarily essential, what does that look like? And that makes you be in the public eye.
Yeah. So many other factors, I think, that aren't being considered and that, need some light put on them. I hope that people will start coming forward with their stories. I definitely want to hear them because I think that's our most effective way of communication, especially right now, is just to sit down and tell someone your story, your experience with something, because then it becomes so much more relatable and you're like, oh, so that's why they think that. They're not a conspiracy theorist. They've had an experience where they had a certain outcome. And so they dove in and they learned about why they had that outcome. And now they don't do that anymore. Well, that makes sense, doesn't it?
Totally. And I also want to hear from, friends and people we know on, if they have anybody that has had COVID and
what that experience was like.
We help them. And
what would you do different?
Yeah. And it's even though Ayurvedic medicine doctors and practitioners are considered, I don't know, not essential. Why become a medical practitioner if you don't want to work with sick people? That's essentially what all of us are trying to do. Whether you work in a hospital, you have a clinic, you work out of your home, what have you.
Right.
You are deciding to do medicine to heal people, even if that is contagious.
Yes.
With that being said, I think that the acupuncturists and chiropractors and all these different people that were told, no, you can't open. There's a lot of power in that medicine that's not even being
accessed,
looked at all.
Yeah. So on that note, I want people to be able to connect with you. So how can they reach you? So you have a service. You're providing a service to people. Tell us about that.
Yeah, so I work with people all before birth, during their pregnancy, at their labor unlimited, and other people will hire me specific to do consultations prenatal, postnatally, and help them address certain issues, whether it be acute or chronic. Or the biggest one here, I would say, is anemia.
Interesting.
Most women are anemic. Uh, to me, I think the elevation does have a lot to do
Hmm.
uh, with the iron in our blood. Um, and you can tell by looking at somebody's skin under their eyes if they're not really red. If you press on the fingernail and it's not red when you do that,
Hmm.
you're probably needing some iron.
Interesting.
Um, Postpartum, I work in people's homes. I do Abhyanga massage, which is a circulatory and lymphatic Ayurvedic massage that helps increase milk supply, helps provide uh, suppleness to the joints, lubricates the joints, um, helps swelling within the body, is very grounding and calming, and also minimizes that air element or vata, which is highest during postpartum. So to put it briefly, the first 42 days postpartum, the first 6 weeks are the most important per Ayurveda. How you're taken care of during that time as a woman can affect your health, or does affect your health 42 years later. A lot of different health complications do
Whoa.
stem post birth. So if you
Oh
ask,
man, I wish I had known that.
their moms, like, oh, once I gave birth and then I've had this, really horrible issue with uh, my periods or severe back pain. Both of those are vata disturbances. Or I had extremely high blood pressure, or my blood sugar spiked significantly. So that time is so sacred in itself. So it's bringing in ancient wisdom into modern day times,
Right.
which we can learn a lot from people that have been here before us, because we know that history repeats itself.
Hmm.
Um, so yeah, I have a website.
And
I
what
work,
is your website?
so it's Alyssa, Alyssa, M is in Mary, doula, Doula, .com.
Okay. And I wanted to say your Instagram's awesome.
Oh,
She posts all these wonderful pictures of this food that she's preparing for these mamas and these families. And, she cooks for them in a medicinal way. And she posts pictures about them. And I'm like, I want to learn how to make that. I need to learn how to make that. So follow Alyssa on Instagram. What's your handle?
um, at Ayur, underscore doula, Doula. I work with a group of women here in Boulder County in Denver, Balanced Beginnings Doulas. So there's a group of us. There's some
Okay.
that help with sleep support, others that offer birth support. One of my main mentors, she's been practicing for 32 years, not in an Ayurvedic medicine perspective, but within the birth world. So she's really seen things. A lot has changed within
Oh,
5,
I bet.
10 years, never mind 30.
Right.
So she's helped me quite a bit over the past couple of years, because she's seen it all. So
Yeah.
we work together. Um, so yeah.
That's awesome. And so you're continuing your studies in Ayurvedic medicine?
Yeah. So uh, it is pretty full time. It's like having a job.
Hmm.
I was able to go to class, and then COVID happened. And for me
Hmm.
to sit at my computer for 6 hours or 5 hours at a time is really hard, because it's such complex information. I would
Hmm.
say even more so than going through studies, because it's multidimensional.
Right.
So hopefully, I don't know. I think I'll be a student of Ayurveda for life, because there's just so
Yeah.
much to
So
learn.
much to learn.
So I
But
think
that's how it should be. I love that kind of concept of like, you're never done. You're never hit an expert level because you're just hit another level.
Yeah, yeah, totally. And I feel like he's still learning, and our teacher, and he learned so much from us, and we learned so much from him. We have a food scientist in our class. We have a pharmacist in our class. We have a scientist in our class. I think that is enough right there to be like, whoa, okay, we have these people that have different perspectives, and now they're coming to this table because there's something missing.
Right. Right.
So it's been so cool to be able to, there's people I think that just want to know more versus, hey, they're telling me to do this, we'll just do it.
Yeah. Well, I love the impact that you're making, and that you're working with these families to support them in a whole way. I love that you're doing that, and knowing that there's people out there learning about it and continuing to learn about it gives me hope for the future.
Yeah.
It really does, because I think, there in a time where you can voice yourself quite loudly from a platform and have a lot of people listen, sometimes it feels like, oh my gosh, we are going down the wrong way here. But I really do think this, for as many people that are choosing to voice their opinions so loudly, I think there's twice or maybe even 3 times as many people out there working on a daily basis to make changes in the health field. They're not buying the garbage. They're looking at the ingredients before they buy it. They're supporting small business and small farmers and organic living and clean lifestyle. They are doing it. They may not be yelling about it, but they're doing it.
Yeah.
And you are the epitome of that example.
Trying. Yeah, it's so hard because I want to support all these restaurants during this. So we've been going out to eat or ordering, but also right now I'm like, oh, we should only be eating at home because this is the good. So there's a balance, there's a balance with everything.
Yeah.
Occasionally I'm like, oh, there's Doritos. I haven't had those since I was a child. Let me
Yeah.
have
And that's what it's all about. There is no such thing as perfection. There's a process.
No, 80-20 rule, 80% of the time. And, your body will thank you for it.
Yeah. Yeah. Well, thank you, Alyssa. It's been a pleasure talking with you today. I'm so happy that you joined me here on the Naturally Inspired podcast, and I look forward to having you on again.
Yeah. Thank you for having me. Take care.
You too.
Bye.
If the Naturally Inspired movement makes sense to you, let's do this together and transform the medical model and help people take charge of their health. Learn more about how you can join the Naturally Inspired movement by going to naturallyinspiredadvocate.com or call me at 970-475-4862.